Welcome back to AI Podcast.
Huh.
We are diving deep today into AI in surgery.
Oh, yeah.
Um, you know,
Yeah.
robotic arms, precise movements, all guided by artificial intelligence.
hmm
It's really incredible stuff.
It's amazing.
And we're going to unpack it all for you today.
I think it's fascinating how, AI is sort of pushing the boundaries of what's possible in surgery.
Right.
And we're not just talking about robots like taking over.
Yeah.
It's more about how AI can amplify, like enhance the surgeon's skills
Sure.
and, make procedures even more precise and less invasive for patients.
Yeah, so let's start with the basics.
Sure.
How does this robotic-assisted surgery actually work?
So think of it as like a high-tech partnership
Okay.
between the surgeon and the machine. So the surgeon actually sits at a console,
Okay.
and this console gives them like a 3D high-definition view of the surgical field.
Wow.
And they control these robotic arms,
Uh,
which are positioned right next to the patient. And these arms translate the surgeon's hand movements into incredibly precise actions.
so the surgeon is essentially controlling these robotic arms remotely.
That's right.
Wow.
It's almost like playing, a video game, but with very, very real-world consequences.
Right, high stakes.
High stakes.
High stakes video game.
Exactly. And these robotic arms offer a greater range of motion, more dexterity than human hands, allowing for these, really intricate maneuvers.
So where does the AI fit into all of this?
So the AI is like the secret sauce that takes robotic surgery to the next level. It analyzes tons of data from the patient's medical history to like real-time information during the procedure.
Wow.
It's like having a supercomputer in the operating room, constantly crunching numbers, offering insights that, would be impossible for a human to process that quickly.
So the AI is acting as a sort of co-pilot for the surgeon, providing them with like real-time feedback, guidance, things like that.
Exactly. And for example, like AI can analyze the patient's anatomy, suggest the optimal placement for an implant,
Okay.
or even guide the surgeon's hand to like avoid critical structures.
That sounds incredible.
Yeah.
Can you give us some specific examples of how AI is being used in different surgical specialties?
Absolutely. Let's start with orthopedics.
Okay.
So AI-powered systems like Mako and ROSA are like revolutionizing joint replacements.
Okay.
They use these 3D models generated from the patient's CT scans
Mm-hmm.
and help surgeons plan the surgery with incredible accuracy. So for a knee replacement, for example,
Yeah.
the AI can actually guide the robotic arm to remove only the damaged bone and cartilage.
Okay.
So it's preserving the healthy tissue.
So it's not just this one-size-fits-all approach. It's very much tailored
Exactly.
to the patient.
Precisely.
Very cool.
And this leads to less pain, faster recovery, better long-term outcomes.
Wow.
So now let's move on to neurosurgery.
Okay.
So think about the complexity of operating on the brain,
Sure.
where even the slightest error can have, devastating consequences.
Right.
So AI-powered robotic systems like NeuroArm and ROSA Brain are assisting surgeons with these incredibly delicate tasks,
Mm-hmm.
like tumor removals,
Okay.
deep brain stimulation, and epilepsy surgery.
It's mind-blowing to think that robots are now operating on the most complex organ in the human body.
It is.
Wow.
It's truly remarkable.
It's incredible.
And it's not just about precision, right? AI can also help surgeons make more informed decisions during the surgery. For example, it can analyze that real-time data to predict potential complications,
Oh, right.
like bleeding or changes in blood pressure, and alert the surgeon in advance.
Wow, so it's like an early warning system
Exactly.
in the operating room.
Yeah, allowing them to take proactive steps to mitigate those risks.
Now, what about cardiac surgery?
Mm-hmm.
I imagine precision is paramount there as well.
You're absolutely right. So in cardiac surgery, AI is enhancing minimally invasive procedures,
Okay.
like coronary artery bypass grafting.
Yeah.
So the AI can provide surgeons with a very detailed 3D map of the heart's arteries
Oh,
and guide the robotic arms with incredible precision,
okay.
minimizing damage to the surrounding tissues.
Gotcha.
And there's also the CorePath GRX system, which uses AI to assist surgeons with percutaneous coronary interventions.
Okay.
So this involves inserting stents to open blocked arteries.
Okay.
And the AI in this system helps optimize stent placement and reduce the risk of complications.
It seems like AI is touching every corner of surgery.
It is. I mean, it's really incredible.
Now, what about general surgery?
Yeah.
The kind that most people might encounter at some point.
Yeah, general surgery is another area where AI is making a significant impact. So the Vinci Surgical System, which is already widely used for these minimally invasive procedures, is being enhanced with AI capabilities.
Okay.
This includes things like real-time image analysis to help surgeons identify critical structures and predict potential complications.
Yep.
So AI is being used in procedures like hernia repairs, gallbladder removals, and even bariatric surgery.
Wow.
And what's really exciting is the potential for AI to actually personalize those surgical plans.
Oh, wow.
So it can analyze a patient's specific data, including their medical history,
Okay.
imaging scans, and even genetic information
Wow.
to develop the most effective approach for their individual needs.
That's fascinating.
Yeah.
It's not just about making surgery more precise,
Mm-hmm.
but also about tailoring it to the individual patient.
Exactly.
Wow, that's really amazing.
That's what's so revolutionary about AI in surgery. It's not just about replacing human surgeons with robots.
Right?
It's about using AI to enhance their skills, making the procedures less invasive,
Right.
and ultimately improve patient outcomes.
Yeah.
Which is what it's all about.
That's amazing.
Yeah. We've been talking about, all these amazing advances, how AI is revolutionizing so many different types of surgeries.
Right.
But it's also important to acknowledge, Yeah.
The unique challenges
Sure.
that AI brings to the operating room.
That's a good point. It's easy to get swept up in the excitement of new technology, but
Right.
we need to be realistic about the potential downsides as well.
Absolutely. One of the biggest hurdles is the cost
Okay.
of these robotic surgical systems.
Yeah.
I mean, they're very expensive to acquire and maintain,
Yeah.
which can make them, inaccessible
Right.
in smaller hospitals or regions with limited resources.
Yeah, accessibility is definitely a concern.
Yeah. And so we need to make sure that this technology
Right.
is available to everyone who needs it,
Mm-hmm.
not just those who can afford it.
And even if a hospital can't afford the equipment, there's still the issue of training.
Right.
Surgeons need specialized training to operate these systems effectively.
Exactly.
So I imagine there's a learning curve involved, which could impact outcomes,
Yeah.
especially in those early stages.
You're right. It's not as simple as just plugging in a robot and letting it do the surgery.
Right. Surgeons really need to understand the nuances of the technology,
Sure.
its limitations,
Yeah.
and how to best integrate it into their practice.
Yeah.
And as AI becomes more sophisticated,
Right.
the training will need to evolve as well.
It's a bit like learning to fly a plane.
Yeah,
You can't just jump in the cockpit and expect to take off.
exactly.
You need extensive training and experience
Right.
to handle such complex machinery
Exactly.
safely and effectively.
And just like with pilots, surgeons need to be prepared for those unexpected situations.
Yeah.
When things don't go according to plan,
Right.
that's where human judgment and expertise
Yeah.
become even more crucial.
So it's not about replacing human surgeons with robots.
Right.
It's about finding the right balance
Mm-hmm.
between technology and human skill.
That's the key. AI can enhance a surgeon's capabilities,
Mm-hmm.
but it can't replace, the human touch,
Yeah.
the intuition, the ability to make split-second decisions
Right.
in critical moments.
Now, we've talked about cost, training, but what about data privacy?
Right.
These AI systems are analyzing huge amounts of patient data.
Yes.
Is that a concern?
Absolutely. Protecting patient privacy is paramount.
Mm-hmm.
These AI systems rely on vast data sets
Yeah.
for training and analysis.
Right.
So ensuring the security and confidentiality of that information
Sure.
is absolutely critical.
Okay.
We need robust safeguards in place
Yeah.
to prevent any breaches or misuse of that sensitive medical data.
It's like having a bank vault for medical information.
Exactly.
You need multiple layers of security
Right.
to keep that data safe and secure.
And as AI becomes more integrated into healthcare,
Yeah.
we need to have those open and honest conversations
Right.
about these ethical considerations.
Mm-hmm.
How do we balance the benefits of AI
Sure.
with the need to protect patient privacy?
Right.
How do we ensure that these systems are used responsibly and ethically?
That's right.
These are questions we need to address as we move forward.
It's a bit of a tightrope walk.
It is.
We want to embrace the potential of AI in surgery,
Yeah.
but we need to do so in a way that prioritizes patient safety,
Right.
privacy, and ethical considerations.
Mhm.
It's not just about technological advancements.
Mm-hmm.
It's about ensuring that those advancements are implemented in a way that benefits everyone.
I couldn't agree more. It's a conversation that needs to involve not just scientists and engineers,
Yeah,
but also ethicists,
sure.
policymakers,
Right.
and most importantly, the patients themselves.
Absolutely.
We need to consider all perspectives
Mhm.
as we navigate this new landscape of AI in healthcare.
Now, despite these challenges, the future of AI in surgery seems incredibly promising.
It is. It's really exciting.
What are some of the most exciting advancements on the horizon?
One area that's generating a lot of buzz is the development of autonomous surgical robots.
Okay.
Imagine a robot that can perform those routine tasks like suturing
Yeah.
or biopsies with complete autonomy, while freeing up the surgeon to focus on the more complex aspects of the procedure.
That sounds like something out of a science fiction movie.
It does, doesn't it?
But if it could make surgery more efficient, perhaps even less expensive, that would be a game changer.
Absolutely. And AI is not just about automating tasks, it's about creating a more personalized
Okay.
and intuitive surgical experience. We're talking about AI systems that can actually learn
Uh-huh.
from each surgeon's individual techniques,
Wow. Yeah.
adapting their assistance
Yeah.
to match the surgeon's preferences and style.
It's like having a surgical assistant who knows your every move, anticipating your needs before you even ask.
That's a great analogy.
Yeah.
And let's not forget about the potential of AI in surgical training.
Right.
So we're already seeing the use of VR and AR simulations powered by AI
Okay.
to create these incredibly realistic and immersive training environments.
Oh, wow.
This allows surgeons to practice complex procedures in a safe and controlled setting,
Yeah.
getting feedback from that AI system in real time.
It's like having a flight simulator for surgeons.
Exactly.
They can practice all sorts of scenarios
Yeah,
and hone their skills without any risk to patients.
exactly. And these simulations can be tailored to each individual's learning style and pace.
Wow.
They can also track the surgeon's progress over time, identifying areas where they need more practice or guidance.
This is incredible. It seems like AI has the potential to revolutionize not just how we perform surgery,
Right.
but also how we train the next generation of surgeons.
You've hit the nail on the head. AI is not about replacing human surgeons.
Yep.
It's about empowering them with the tools and insights
Right?
they need to perform at their very best and to provide the best possible care
Yeah.
for their patients.
This has been a fascinating exploration of the world of AI and surgery.
It has.
We've covered so much ground, from the nuts and bolts of how these AI-powered robots work
Mm-hmm.
to the ethical challenges
Right.
and the mind-blowing possibilities that lie ahead.
Yeah.
But there's one question that I think a lot of our listeners are wondering about.
Okay.
If these robots become more and more autonomous,
Yeah.
where does that leave the human surgeon?
Right.
What role would they play in this increasingly automated future?
That's a great question, and one that we'll dive into when we return for the final part of our deep dive into AI and surgery.
Welcome back to AI Podcast for the final part of our deep dive into this fascinating world of AI in surgery.
Yeah.
You know, we talk about how AI is like changing the game in operating rooms around the world,
Right.
but it's clear that this is just the beginning.
Yeah, it really is just the tip of the iceberg, and
Right.
as these robotic systems become more sophisticated,
Yeah.
it's natural to sort of wonder, like, what role
Yeah.
will human surgeons
Yeah.
play in the future?
Exactly. If we're talking about robots that can perform surgery autonomously, will human surgeons become, like, obsolete?
That's a question that comes up a lot. I don't think it's the right way to frame the issue. Instead of thinking about, AI as replacing surgeons, we should view it as augmenting their skills and expertise.
So it's more about collaboration than competition.
Absolutely.
Okay.
AI excels at processing massive amounts of data, identifying patterns,
Sure.
and making predictions.
Yeah.
But surgery requires more than just data analysis. It
Oh, yeah.
requires judgment, intuition, the ability to adapt to those unexpected situations.
Right.
These are qualities that, at least for now,
Yeah.
remain uniquely human.
Even with all the advances in AI, we're still a long way from robots being able to handle every situation that might arise during a surgery.
Yeah, the human surgeon brings a wealth of knowledge,
Yeah, sure.
experience, and ethical considerations to the operating room.
Hmm.
AI can enhance those abilities, but it can't replicate them entirely.
So rather than fearing a future where robots take over the operating room, we should be envisioning a future where AI and human surgeons work together, like as a team, each leveraging their strengths to achieve the best possible outcome.
It's about creating that symbiotic relationship
Yeah.
between human expertise and AI's, analytical power.
Right.
Imagine an AI system that can like analyze a patient's vital signs in real time
Okay.
and alert the surgeon to, subtle changes that might indicate a potential complication.
Right.
Or an AI that can suggest like alternative surgical approaches
Hmm.
that the surgeon might not have considered based on its analysis of thousands of similar
It's
cases.
like having a super intelligent assistant by your side, constantly analyzing data and offering insights that can improve your decision making.
That's a great way to put it.
Yep.
And as AI continues to evolve, we can imagine, even more sophisticated forms of collaboration.
Okay.
Think about like AI systems that can learn from each surgeon's individual techniques and preferences, adapting their assistance to match the surgeon's unique style.
It's almost like having like a personalized AI coach, helping you to refine your skills and become an even better surgeon.
And this personalization extends to surgical training as well.
Sure.
VR and AR simulations powered by AI are already like revolutionizing how we train the next generation of surgeons.
Right.
These simulations allow trainees to practice those complex procedures
Hmm.
in a safe and controlled environment, receiving real-time feedback from that AI system as they go.
It's like having a flight simulator for surgeons.
Exactly.
They can practice all sorts of scenarios
Yeah.
and hone their skills without any risk to patients.
And these AI-powered simulations can track the trainee's progress over time, identifying areas where they need more practice or guidance. It's a level of like personalized instruction
Right.
that was simply not possible before.
So the future of AI in surgery is not about robots replacing human surgeons. It's about creating a more collaborative
Right.
and personalized approach to surgery, where technology enhances human expertise,
Absolutely.
leading to better outcomes for patients.
That's a great summary. It's about, embracing the incredible potential of AI
Right.
while recognizing that there are certain aspects of surgery, such as judgment, compassion,
Sure.
and the human touch,
The human touch.
that are simply irreplaceable.
This has been a really eye-opening deep dive into the world of AI in surgery.
It has.
We've explored the cutting-edge technology,
Yeah.
the groundbreaking advancements,
Mm-hmm.
and really a future where AI is an indispensable partner in the operating room.
Right.
It's a future filled with both exciting possibilities and those really important ethical considerations.
And it's a future that's unfolding right now at an incredible pace. It's essential that we keep having these conversations to ensure that we're developing and using this technology responsibly, ethically,
Yeah.
and in a way that benefits everyone.
Well, thank you for joining us on this incredible journey, and be sure to tune in tomorrow for another episode of AI Podcast, where we'll explore a new and fascinating topic at the forefront of artificial intelligence.